Go, it's recording.
Oh, I'm so scared. Oh, sir, I can't.
You can do it. Come on. Open up. Open up. Open up.
Let's move the camera. So, how many times have you ever seen this happen or heard about this happening before? Somebody passing out because they're so frightened. Anybody ever heard about this?
2 times.
Well, to start off with, my name is Angela Munson, and I'll be giving a speech on vasovagal syncope. And my audience is Captain Taomi, Staff Sergeant Stoudemire, Major Maurer, Sergeant Ueno, and Mr. Tom. Okay. And the reason that I'm giving this speech on vasovagal syncope is because I think it's important for all of us to learn about it, especially being in the healthcare field, because it's said that 50% of people will go through some form of this in their lifetime. So I just think it's very important. Okay, and the topics I'm going to cover are what it actually is, and the signs and symptoms, and treatment, and prevention. Okay, syncope is a neurocardiogenic, that's another name for it. Most common type in young people, but it can happen at any age, even in healthy people, it doesn't matter. Alright, now I'm just going to tell you what it's all about. Vasovagal syncope is when you have an emotional stimulus to trigger an episode. It's caused by fear, anxiety, stress, strong emotion, but if you're over 40 years old, you don't necessarily need to have an emotional stimulus or any triggers. It happens when there's not enough blood flowing to the brain because your blood produces a type of sugar, glucose, and when your brain doesn't get enough of this, you're going to mess up. Alright, it has some visual aids. And on this you can see that it has the parasympathetic and the sympathetic nervous systems. And when the two are in balance, that's when you have homeostasis, and that's what keeps us running and functioning normally. But when it's thrown out of balance, then that's when you pass out or things go wrong. And as you can see in it, the parasympathetic is like your rest and digest. It's what takes over when you're relaxing or not doing much. But when you have a emotional stimulus or when you get scared or something like that, that's when your fight or flight takes over, and that's the sympathetic. So what that does is accelerates your heart, constricts your blood vessels, and so that's when you get your blood pools at your legs. And when it pulls at your legs, obviously it's not getting to your heart, and when it's not getting to your heart, it's not going to get up to your brain, and that's what's going to cause you to pass out. This can happen anywhere, like I said. Anything that's high anxiety or causes stress. I could pass out right now because I'm nervous. Anything. So while I've been at Spiker Dental Clinic, I have seen 2 cases. And the first one was caused by pain. He was in such pain that it actually triggered him to go into a vasovagal syncope attack. And the second one was from dehydration and a lack of sleep and kind of like a stress situation. I referenced a book by Robert Garcia on syncope cases, and it had a case study in there of a 42-year-old man that had 6 syncopal episodes within 2 years. And there was no warning signs, no triggers, he would just lose consciousness. And that still fell in the category of vasovagal syncope because after the age of 40, like I said, you don't need any kind of triggers or anything. But it was fixed with a pacemaker, which I will talk about more on the treatment. And Now we're going to move on to see what signs and symptoms to be aware of. For the most part, it's quite obvious. From the patient, you will notice physical signs such as nausea, vomiting, sweating, uncomfortable, looking or feeling cold or extremely hot, pale and uneasy. You have to pay a lot of attention to the patient because from the onset of the symptoms to actually them losing consciousness can be just a matter of seconds. So you have to pay really close attention, especially what they tell you, because the symptoms that they can hear but you can't see would be buzzing in the ears, lightheadedness, visual disturbances, or just a few. And now that we know what it is and what to look for, I'm going to talk about preventative measures. And treating syncope, it's mostly about preventing the episode before it starts and getting educated on what syncope is and getting to know like your patients, or they need to get to know themselves. And during an episode, treatment of the patient should be in a supine position with their feet elevated above the head, or above the heart, to get the blood flowing back to the brain. You always want to monitor their blood pressure, their pulse, and their temperature at all times because it should be moving back to normal numbers. And if it's not, then that can indicate something more serious. You want to keep the patient warm since their body temperature will probably be going down because of their circulation. And always check for head injuries, especially if they've fallen. Check for that. And you want to keep good communication with the patient, and you want to keep telling them everything's going to be okay and they're going to come out of this. Because an episode usually lasts about 2.5 minutes, the whole thing from showing symptoms and everything to them actually coming back together. And they probably won't remember a lot of it. And according to vasovagal syncope test and diagnosis, I was from the MayoClinic.com, it says to have patients tested for heart problems if it's a recurring event, and a doctor would know that after checking their medical history. They may need a pacemaker, like I said in my other case study. And some of the tests that they could have done would be like electrocardiograms, echocardiograms, blood tests. They have this tilt table test, which is really cool when you think about it. But you need to have the patient practice anxiety and stress relief management of whatever triggers their episodes. Or the doctor could prescribe some kind of medication that would benefit them. And they need to stay hydrated before appointments. Now that you know about vasovagal syncope, let's review. First we talked about signs and symptoms, and we talked about what it is, and then we went on to preventative measures and treatment. So the next time you're at a healthcare provider's office, or even just standing in line at the fair, and somebody passes out, you will know a little bit about it, so maybe you can help somebody out.
I have a question.
I'm going to stop this before I start the